Most of us enjoy the outdoors, but exposure to sun poses a risk of skin cancer. Dr. Tim Jochen of Contour Dermatology in Palm Springs explains the treatments for this disease.
When a person presents to my office for a skin cancer evaluation, we look at a few things. First thing we look at is the patient's skin type. Second thing that we talk about is sunburns early on in childhood. People that have had sunburns in early childhood are more likely to develop skin cancers. In fact, I have one gentleman who had one sunburn early in his life, and he develops skin cancers all the time. He's in my office every month for a new skin cancer. But when a person comes to my office and I look at their skin, I look for spots on their skin that are red, scaly, spots that haven't gone away, spots that bleed, spots that have changed. And we're looking at basically three types of skin cancer in a dermatology office. We're looking at basal cell carcinomas, which are the most common form of skin cancer. And this type of skin cancer will classically look like a pearly papule with a central depression. It's a shiny surface, and oftentimes it'll have blood vessels running through it. Sometimes these will bleed. They're often called rodent ulcers. The second type of skin cancer is the squamous cell carcinoma. And with this type of skin cancer, it is usually a scaly red spot on the skin, and sometimes it'll bleed. The most dangerous or deadly form of skin cancer and the least common form of skin cancer is the melanoma. And with this, people always want to know, how do I tell a melanoma from a classic mole or a benign mole? And we do the ABCDs of melanoma, where A stands for asymmetry, B stands for border, C stands for color, and D stands for diameter. With asymmetry, we're talking about one side not looking like the other. B is an irregular border or diffusing pigment. C is color variability or a black lesion. Something that's very black is bad. And D is diameter greater than 6 millimeters. And that would be approximately the size of a pencil eraser. There are several treatment options for people who have skin cancer. One thing I'd like to mention is that precancers are one of the most common things I see in my office, and it's called an actinic keratosis. And an actinic keratosis will look like a red scaly spot, and these have approximately like 10% chance of turning into an actual skin cancer, a squamous cell carcinoma. So we treat those by using liquid nitrogen. That's the most common form of therapy. You also have topical medications that you can use. You can use a chemotherapeutic agent called Efudex. Now, for the non-melanoma skin cancers, the basal cell carcinomas and the squamous cell carcinomas, the most common way of treating these is to do what we call a surgical excision. And with this, what we'll do is we'll take out the tissue that we think the cancer involves, plus a little margin of normal tissue. And with this, we'll try to eliminate all the cancer cells. We'll then send it to the pathologist. They will look at it under a microscope and make sure that we got all the cells. We then close it up and leave a small surgical scar. And I always like to go back in 6 weeks to 8 weeks and dermabrade the area to try to minimize the scarring. Another technique that is commonly employed is the Mohs micrographic surgery. Now, the nice thing about this procedure is that we minimize the amount of tissue that we take out, so that minimizes the amount of scarring, and we also maximize the opportunity to get the whole cancer. And so with this procedure, we have greater than 99% chance of getting the whole thing. Finally, there are some new biologics that we're using, and a biologic therapy is a therapy where we use the body's own immune system to fight off a cancer. An example of this is Aldera. And Aldera was actually developed for genital warts. And what it does is you apply the cream and it upregulates your body's immune system to go and fight a virus. And they've also found out that it'll go and fight off a cancer. This is a beautiful way to do it because you end up with no scar whatsoever. There are people that believe in the next 10 years that surgery will no longer be performed on skin cancers because we will progress with a biological therapy.